Think about
yeah.
it now. It's
Okay.
us just chatting.
Yeah. Yeah. Okay.
Okay.
Hey friends, welcome to the channel and welcome to After Rounds, where medicine meets life. This is a platform where we will have medical people come and we sit, have meals, and talk about things medicine related. I'm your host, I'm Ratang. I'm a junior doctor currently based in Pretoria in South Africa. And whether you are in medicine or you're looking to get into medicine or you simply just love hearing a good story, then maybe this may be a good place for you. And actually, what a better way to start than with our very first guest, Buhle. How are you doing, Buhle?
I'm doing great. It feels great to be your very first guest.
Yeah.
Yeah, look forward to it.
Yeah, so there's a number of things about interesting about Buhle. But do you want to maybe like introduce yourself maybe first before?
Sure. Okay.
Yeah.
So I'm also in the medical field. Currently doing my internship. Also in Pretoria. Yeah, but almost towards the end. Thank God. Yeah.
Yeah. So I'll tell you more about Buhle. So Buhle, first of all, as she said, she's a medical doctor. She went to UCT, University of Cape Town, to study medicine for 6 years. And prior to that, actually, she spent a bit of time in Saudi Arabia, where she did her high school there. Right?
Yeah.
And also, the other interesting thing about you, I think, is that you have interest in the MSF, the Medicine Sans Frontiers. So that is commonly known as Doctors Without Borders. The thing I always wonder is how did you develop interest in the MSF as an organization?
Sure. Okay. So I think
Do you want to maybe tell us what MSF is?
MSF.
Yeah.
Okay. So like you were explaining, so it's Medicine Sans Frontières, which is basically.
Oh, you say it a lot better than I did. I said Medicine Sans
I mean,
Frontiers.
to be fair,
Okay.
we're not French,
Yeah,
but
yeah.
that's essentially it's like the abbreviation in French. So they do mission work essentially. So they are an organization of doctors. They will go to either war-struck countries where there's famine, where there's just need for medical services, and then doctors will obviously then gather. They will offer medical services to these often remote areas. And they travel, so they do what's called missions. So they'll travel some months at a time, and just offer their help in any way that they can in those countries.
Yeah.
So you might have actually heard about them, in areas where there's maybe Ebola outbreak, or if there's a war, like during the whole Sudan war, many different areas. There's just very few things that we mention.
Yeah. So yeah, and then how did you develop interest in the MSF? Because I think actually you are the very first person that I know that I've met that has, or had at least, interest in the MSF. Because it's a lot.
It sounds a bit extreme.
Yeah.
No,
it does. So how do you even start to, or maybe firstly, how did you get exposure to the MSF? And when did you decide that actually I think I like the MSF? Maybe it would be nice at some point to join the MSF.
So not so much exposure, unfortunately, but I think growing up, I don't even think I've even shared this with you, but growing up, I think I was a bit of an adrenaline junkie. I've always been drawn to the weird and the wonderful. I wanted to do things. I still want to. Things like explore the rainforests and go on camping trips. I think I shared at some point, I went on several days of a camping trip in the Omani desert when I was still in Saudi.
Yeah.
And that's probably one of the most amazing experiences that I've ever, been through. So stuff like that, adventure medicine, the idea around adventure medicine, the idea of being able to practice medicine in an unconventional way. So, because when you're in a hospital, I personally find that sometimes it can feel, I don't know, a bit stress evoking. I'm not necessarily the biggest fan of ward medicine, so to speak.
quite interesting that you mentioned like stress. Because when you say stress, I think the MSF is like a lot of stress.
Really?
Yeah.
I think, but it's kinds of stress, and I think it's
Okay.
also maybe the type of stress that you are willing to deal with as a person. I wouldn't mind being in a remote area, for example. You wake up in the morning, you get your water from wherever, you shower,
yeah.
even sleeping in a tent or sleeping, under the mosquito nets. Like I don't perceive that as stress. To me, it feels almost like the complete opposite. Almost like it feels like freedom to me. It feels like really just living, outside of what can sometimes feel like a rat race, So I've always wanted to experience that. So adventure medicine for me is amazing, and people who do it, I'm sure they live very fulfilling lives, so I'd like to think. Yeah. And I think I had that idea from like being a teenager already.
Which is wild, even as a teenager. Okay, so it has the idea or the interest, so to speak, of joining the MSF then maybe like die down a little, or like you're still like maybe like it would be like something to like explore at some point. It's like a big deal, isn't it? I can tell you that I wouldn't do it, and I think it's for the same reasons that there isn't a lot of people who actually are interested in that MSF. But yeah, like do you still maybe like look to explore more about the organization, or do they actually like look to get into it, or?
Interesting that you should say that, because I like having a conversation with you now. I'm like, absolutely, definitely, it's something I'd still want to go back to and like maybe do a mission. I think I'd still be interested in doing that.
Yeah.
However, the other side of it is, I don't know if it's really the easiest thing to get into, like adventure medicine, or maybe it requires a bit of bravery, because it's quite unconventional. When you look at the way that we go through medical training, it's medical school, it's internship, then it's ComServe, and then you go into hopefully you're in MO and then reg time. So now that I'm within that entire system, it's very difficult to pinpoint when I think I'd be able to just step aside and say, let me actually give this a chance, because it somehow feels like you're falling behind the actual training.
I see.
So I don't know. I think it's something that I still have to sit with.
One thing I actually I was sort of like researching about the MSF, Médecins Sans Frontières. Is that how you say it? Okay.
Something like that. I'm not perfect either.
Okay. Médecins, not medicines. So I was like trying to just like research about it and see like in Africa like how many like regional say like, or maybe regions within the MSF are there within like the African continent and so on, and actually like what does it take to like get into the MSF. But like I've seen that they require like a lot of experience, surprisingly, that you have to have like some experience with, say, like maybe something adventurous about practicing medicine. Yeah, it's actually, like say, I don't know how hard it is. It would be to get it if, say, maybe you were just after internship and you're doing your first year of MO time, and you're saying, I have interest in the MSF. Can I apply without necessarily having experience? Which now brings me to your time at UCT. Like, do you think like maybe, obviously, like I don't think it's something that you were actively like thinking about getting into the MSF, especially in med school, right? But like, do you feel that maybe for someone who has that interest, that med school like preps you for it in any way, you say?
So, we actually had an MSF society.
Oh, at UCT?
At UCT.
Really?
Yeah, unfortunately, I think it popped up when I was maybe in 6th year or something like that.
Okay.
Or Friends of MSF. I know there's a Friends of MSF society, yeah. But I can't really speak much on it because I was never a part of it, and I don't know if I just discovered it late. But in terms of prep work, or like what if you feel medical school is going to prepare you for it, I don't think so. I think medical school kind of prepares you to get into
for the ward.
For the ward.
4 rounds.
It preps the ward round.
Yeah.
But it preps you for what we do, like ward-based medicine mostly, and just to introduce you into the clinical space. But I mean, just thinking about it as well, I wouldn't want to go and, be part of a mission feeling as though I haven't gained enough clinical experience.
Yeah.
Because you might even argue, like, you definitely need a lot of experience as a clinician.
Yeah,
you have to have been challenged quite a bit
you don't want
as
to
a
be
medical doctor.
Sure, like you don't want to be like an intern in the MSF. It's like,
you don't want to be an intern in the MSF.
Missiles are like going all over, and then you're like, oh, like,
hey,
how
can
do
I discuss the patient with you?
Yeah, okay.
No. Side note, please stop.
Yeah.
But yeah, I also would rather feel, in fact, since I'm interested in like surgical specialties, if I were to be part of the MSF, I think I'd want to go as a consultant.
Really?
Yeah.
That's interesting.
Yeah.
Okay. Is it coming from just experience side, or maybe, no, maybe say like the experience you've had in terms of like say number of years in the medical field? Say that, maybe it would be nice to go maybe after like 5 years or 10 years worth of experience, or is it also like expertise that you'll be bringing?
I think it's a bit of both. I think in those situations, obviously, like, they probably have a philosophy of like, the more hands, the better, or whatever.
Yeah.
But I would feel that it's my responsibility, at least, to bring the most expertise and the most experience to an environment like that. Not to say there isn't room to grow, but I would want to be confident that I can deal with a lot of clinical situations. It's probably one of the most unpredictable situations you can be in medically, but you want to have a sense of expertise and a sense of having things under control. I don't think I have things under control. And now, maybe not in 2 years, maybe not in 3 years.
Hopefully. Hopefully
it will get better.
Yeah,
it will get better. But that's what I mean. Like, naturally, you become better as a clinician. Even making like judgments, assessing situations, you just become better. Like, that's the beauty of medicine, I think. That experience teaches you so much. So I would want to go there when I feel a lot more useful, I think is the word I would use.
Did you engage with Friends with Medicine? Is that what?
Yeah, the Friends
with Medicine.
So no, so like I was saying, I didn't really join the society. I saw them in 6th year. I don't know if they were there earlier or somebody had the idea to kind of bring it onto our campus to get people interested. So I never really got any details around it.
Okay. That's cool then. It's also quite interesting that I went to Wits University, and I don't think I ever heard anything about the MSF. Like from first year all the way to final year, I don't think there was any mention of the MSF.
From friends, from other clinicians.
Maybe clinicians, but it wasn't say maybe we had like organizations or maybe clubs, the MSF, who would maybe like tell us about what the organization is and so on and so on. Which is actually like, I don't know, I feel like it's an injustice. So especially people who may have genuine interest in being the MSF.
Like, I think presence in like medical schools should be advocated because where else,
Yeah, and you can imagine if universities like Wits University, they don't have that organization through them. You can imagine like most likely like other universities also don't have. So like maybe as a country we're not doing like very well.
Yeah.
in terms of like bringing exposure to the MSF.
I'd agree with that.
Yeah.
Because it's really something you have to be aware of and know that it exists.
Yeah. How's internship going?
Well,
being an intern in SA,
being an intern in SA, being a doctor in SA, full stop. A lot better.
Yeah, then.
I think a lot better, period. So this is probably the most comfortable I've been in internship. And also I can feel myself engaging a lot more like in the clinical field and just gaining a bit more confidence in your own skills, a bit more confidence in how you assess and treat patients. So I feel great. Like you start feeling like you're a doctor. at this point.
But you said better than what? Like
First year.
Okay.
I mean, first. Come on. Okay,
so
first year.
So Bushle is a second year medical intern.
Yes.
Doing a second year. So if you're not familiar with the program in South Africa, so internship is like a 2-year program. You do first year, second year. You do like rotations in departments in first year, and then rotations in departments again in second year.
The big four.
The big four, like obstetrics, whatever. And then, but I think she's comparing to.
Okay,
to
so I'm
first year.
comparing it to first year.
Yeah.
First year, you're straight out of medical school, and the thought of being left alone in a ward with patients, like, terrifies you.
Yeah.
Because you think of the worst case scenario. You think, what if I have to resus somebody and my seniors are not around? What if, like, that's not the case, obviously. Like, you always have supervision, but the step from being a student to being an intern and having that amount of responsibility is scary, I think, in first year. Now it's kind of you're aware of the responsibility, and I think your focus shifts a bit from focusing on what's the worst that could happen to, hey, like, actually I can, assess patients, I can treat patients, I can, obviously you still need to discuss and, get your seniors involved, but you feel a lot more confident managing certain conditions. I think by the end of second year, you should be confident in certain things.
Oh yeah.
And you begin to feel that confidence, and then it's kind of preparing you as well for ComServe, so that ComServe doesn't feel like, a nightmare.
Yeah, which is next year. So
Like in a few
it's currently
months.
like August, and we're both doing second year of internship, and we'll both be applying very soon for community service. By the way, if you've have tips on like places to go to, like what interests you have, say maybe like interested in the surgical specialties, that kind of vibe. Like I'm on Instagram, she's on Instagram. You can always just help us with information regarding that, or even like in the comments. But yeah. So to end off the chat, I have a few rapid fire questions for you. Number one, what is the most underrated thing about UCT?
I think we are very decent in how we manage diversity in our university. It's very, very diverse. You've got international students, you've got people from different parts of the country. I think we're decent, like not perfect, but decent.
Okay. All right, that's cool.
Yeah.
And then what is the most overrated thing about medical internship in South Africa?
Most overrated. Sure. I think the hours.
Okay.
Yeah, the hours.
Yeah.
The hours. It sounds amazing to be like, yeah, I'm on call, but it can take quite a toll on you.
Yeah.
Yeah.
Yeah. And even like in the ward, like sometimes you are expected to be there until late hours of the day, especially as a first year intern. That you have to be here and be diligent and all of that stuff, which I don't think should necessarily be true, especially because there isn't a lot of clinical stuff that you learn. It's mostly admin stuff, let's be fair.
Listen,
you have to stay over 4.
Okay, to be fair. Unless you have hectic ward work, in which case, Okay. But yeah, you shouldn't have to work beyond your own hours, but it's fine.
Yeah, and then one word to describe the MSF.
Essential.
Okay. And the last question. Chelsea or Man United? Okay, I don't think we need to answer that. But yeah, no. Otherwise, thanks very much for watching, guys. If you think that may be up your street, this kind of a chat, we would love it if you were to join us. There should be more coming on the channel, so be on the lookout. Thanks very much for watching. Truly appreciate it. If you like the video, please give it a thumbs up, and I'll see you next time. Bye.
Bye.
Yeah.